online. All right, so good morning, good afternoon, good evening, wherever you are calling, listening in from the world. On behalf of the Global Frameworks on Chemical Secretariat, I'd like to welcome you to this online discussion, Strengthening Workers' Health and Safety in Chemicals and Waste Management. My name is Chaz Kaiser. I am a communications consultant for the Global Framework on Chemicals, and very happy that there is such a strong interest for this topic. Before we dive in, I, of course, would like to give a big thank you to the Green Growth Knowledge Partnership, particularly Karen Lapitan, who is who is joining the session as well and working in the background. This is actually our third online discussion with the Green Growth Knowledge Partnership, and they've been just an instrumental partner in the GFC, raising awareness about our existence as we are new, and I'll talk about that in a little bit. If you haven't already, I really encourage you to join their Green Forum, which offers interactive discussions for professionals for interested in a wide range of sustainability topics. And I am sure that Karen will drop the website link for that, for those of you who are not familiar with the Green Forum. Next slide, please, Karen. So for those of you who are not that familiar with the Global Framework on Chemicals, just allow me to give you a little bit of background. The GFC is unlike many other frameworks in that it's voluntary. It's a voluntary international framework. It was launched in September 2023. And we have a bold but an ambitious but a very essential plan to create a planet free of harm from chemicals and waste. Of course, this takes the collected effort from basically everyone. And so what makes the GFC especially powerful is this multi-sectoral, multi-stakeholder way of being, the way it was created. So it brings together governments, industry, workers, health and labor specialists like yourself, for those of you who are health and labor specialists on the line, civil society, academia, and it also demands a strong presence from youth, as they are our future. And so all of us working towards more sustainable approaches to the production, use, and disposal of chemicals. You can go to the next slide, Karen. The framework is guided by 5 strategic objectives, and Dorothy, my colleague with the Global Framework on Chemicals, will talk a little bit more about those. But basically, all the objectives, and including our targets, are aimed at just a wide variety of ways to protect human health, the environment. And we have very specific strategic objectives and targets that talk about human health, including protecting those who are most at risk for hazardous chemicals, including those who work in chemical intensive industries and informal waste management. Next slide, please. This discussion is very important because it's going to help inform our discussions at our first meeting of the Open-Ended Working Group in Punta del Este, Uruguay. This will be the first international conference that the Global Framework of Chemicals has, and it is called a meeting, but it really is a big international conference. We have over 600 people registered so far. Over 4 days, we're going to bring together a wide range of stakeholders in person and online, but because we will offer a lot of the sessions online. Key topics, as you can see, include implementation programs. The Global Framework on Chemicals has a heavy focus on sectors, including, of course, health sector and textiles, agriculture, and finance. We'll be discussing advancement of the Global Alliance on Highly Hazardous Pesticides, the Gender Action Plan to weave gender equity into the Global Framework on Chemicals, and capacity building emerging issues of concern. Our website has already listings of the sessions that will be offered, including those that are offered virtually. And in a little bit, I will paste the direct links so you can see those. All right, so for today, we have a couple of session goals. The first is through our experts online, who I will introduce in a second, to highlight key challenges and solutions, of course, related to worker health and safety in chemical and waste management. The second is to collect Global Framework for Chemicals Communities of Practice, which is offered through the Green Forum, and facilitate peer-to-peer learning. So this isn't just a webinar where we're just talking at you. We actually want to encourage communication and online discussion, and that will be coming towards the end of the program. And it's going to be used to inform OEWG discussions. At the OEWG, worker health and safety is interwoven throughout a lot of the topics. And what we talk about here, including with our speakers, who some of them will be in Uruguay, and many of you, I'm guessing, may also be able to attend in person or online. So what we talk about here will be able to help inform those discussions. And last slide, I think. Okay. So I just want to go over the agenda so you can know what is in store. We're first going to begin with framing insights from our experts. We're joined by my colleague, Dorothy, a health and labor officer with the Global Framework on Chemicals, who is new and just hit the ground running. Like within her first week, I was like, you're giving a webinar next month. And she was like, okay. And so she's been on it. We're so grateful. We're also joined by Mani Azizi with the International Labor Organization, and they are co-partnering with this event. We're very grateful. Hauschka is on the line, and she'll be giving a presentation as well. And then we would be remiss not to have people who are actually working on the front lines for health and safety, for chemicals and waste management. We have government representative, including Maxwell Mamusi, employer representative, Robert Marinhovich, and Ripon Chowdhury representing workers who technically we should not have as last bullet point. Let's pretend that's the first one, all right? But so we have someone representing workers as well. And this will be followed by Q&A, so you can ask questions about their specific presentations, and then an open community discussion that will be guided by a few questions that I'll share, okay? So with that, we can go ahead and get started, and we're going to begin with Dorothy. And she's going to be talking about advancing worker protection through the Global Framework on Chemicals. Feel free, as the speakers are talking, to type any questions you have in the chat box, and then we can come to those later. All right, thank you, everyone.
Okay. Thank you so much, Chaz. Good morning, good afternoon, good evening, everyone. It is indeed a pleasure to be with you here today. And as Chaz mentioned, I'm a member of the GFC Secretariat. I just joined last month, and I'm very happy to come to the GFC and in my first month to have the opportunity to speak about workers. So before I go further in my presentation, I thought I wanted us to first begin with a story. Maybe there's a story that we've had only too often, maybe in different forms from different countries. It's not a statistic, but story of real people. So this is a patient that I personally attended to, and it's a reality that has profoundly stayed with me. This was a man who was sent by an employer along with a co-worker to repair a boiler in a basement. What they were doing, they were welding, grinding, and cleaning, and they were using solvents, and the solvents contained toluene. This was not a routine task for them. It was a complex, and it involved hazardous materials and processes. So these individuals were working in a confined space, and as we would all appreciate, it's a known high-risk environment. They had received no occupational safety and health training. There was no, they had poor ventilation, and this is despite having a clear chemical hazards. No PPE was provided, and the only instruction they were given was to get the job done within few hours. So the consequences were immediate and very devastating. One of the workers, that's my patient, collapsed. His muscles started breaking down from the inside and developed this severe condition called rhabdomyolysis, which rapidly led to kidney failure, and that necessitated emergency hemodialysis. This tragedy did not end with just a medical crisis. While the patient was in a hospital bed, his employer sent paperwork to him to declare himself as an independent contractor. Of course, the patient refused to sign. And by the time he was referred to the occupational medicine clinic where I worked, he still had signs of kidney failure. He could not continue working. and he was facing massive medical bills. The employer refused to complete the employer's report of occupational disease, which was important for initiating the compensation claim. And as a treating physician, I completed the medical reports for compensation, notified the chief inspector. However, the investigation on the incident did not occur because there were very few inspectors within the Ministry of Labor, and no one was available to investigate the case. So here I had a father, a sole breadwinner for the family, having lasting health effects, no compensation for their suffering, no justice, and they're facing this problem which could have been prevented. And as I said, this is not a rare case. Across the world, every day, workers face these risks, and some with even fatal outcomes. And this is why we need to talk about workers' protection, not in theory, but also in practice and in people's lives. So the case that I described is just part of a global crisis. Annually, over 1 billion workers are exposed to hazardous chemicals, from solvents to dust to fumes, vapors, and often without adequate protection. And these workers are at every stage of chemicals and waste life cycle, from production to disposal. And this leads to a huge burden of prevented work-related injuries, which includes burn and poisoning, to devastating chronic diseases like occupational cancers, neurological diseases, and organ failures. And each case is a direct violation of the fundamental right to safe and healthy working environment. Most importantly, this burden is not equally distributed, as we all appreciate. It is disproportionately affecting the most vulnerable, the informal economy, low-wage workers, migrant workers, women, and these mostly lack information, training, and protective equipment, including access to occupational health services. So here enters the global framework. So it is very clear from these challenges that we need a unified global response, and this response is the global framework on chemicals. So I'll not repeat what Charles has mentioned, but adopted 2023, integrates worker protection in achieving safe and sustainable future. It has 5 strategic objectives and supported by 28 specific targets. And we'll talk more about which targets are specific for, they speak specific to workers. Just to say, it is supported by the Operational Trust Fund, which successfully launched its first round in October 2024 with initial funding of about 28 million US dollars. The aim is to catalyze and support concrete actions on the ground, helping countries and stakeholders to implement the framework goals. So where does workers fit in the GFC? So here I'm just highlighting some of the fundamental targets that speaks directly to workers. So this is not an exhaustive list. You can find more targets in the framework document. But first is target A1, which is foundational. It mandates by 2030 that government must adopt, implement, and enforce legal frameworks and establish appropriate institutional capacity to prevent harm. And this is the essential bedrock for national occupational health and safety laws that protect workers. Then a more specific target is target D7, which speaks directly to workplace action, where by 2030, stakeholders must implement effective occupational health and safety practices, which means robust risk assessments, control measures, workers training, and this needs to happen across all sectors throughout the supply chain. And then we have target E6, which emphasize on collaboration, policy coherence, so strengthening synergies and linkages between chemicals and waste management and other key policies in health and labor. So beyond these, we also have other targets, A2, B4, B5, B6, etc., which these cover more issues about doing guidelines for risk assessment, education and training, raising awareness, enhancing data access, and also ensuring broader stakeholder engagement. So how do we move from having the GFC global pledge to real worker protection? So I've just highlighted these six key actions which are somehow interconnected. So first is through strengthening legal frameworks by enacting and enforcing laws for worker protection across all sectors. And this is very important and foundational, because sometimes you don't, I mean, for many countries, particularly in developing countries, there's no occupational safety and health legislation. So it's important to have that legal backup for protection. But in some countries, for example, where I worked, there is legal framework, but the enforcement is a challenge because, again, for example, very few labor inspectors to be able to respond to the demands. So it's important to have that legal framework strengthening. Then by translating global commitment into country-level action through integrating worker protection into national policies and programs, especially in high-risk industries. Also, it's important that no single ministry should work alone. So it's important that the health, labor, and environment ministries unite, work together truly to ensure sustainable chemicals management. Investment is also important, and this investment needs to be in prevention and not compensation, as sometimes happens in most countries. So building stronger labor inspectorates, as I've mentioned, better occupational health services, worker training, and also promoting safer technologies. Accountability mechanisms are also important in order to ensure that progress is being measured to drive results. And this can be done by using workplace health surveillance system, for example, using GFC indicators to track outcomes, and these results can inform policy. Finally, is the importance of social dialogue. And as we'll see today, we have representatives from government, employers, and work, and this is very important and essential for policy development and implementation at every level. And this is how the GFC will truly move from this global ambition to frontline protection for every worker everywhere. Just as I conclude, I want to leave you with these three key takeaways from my presentation today. First is that chemical exposure at work is a significant and preventable global crisis. Um, and what we've seen is the devastating human cost when prevention fails. And this affects billions of workers worldwide. And this is a challenge that we cannot afford to ignore. Secondly, we have the global framework on chemicals, which provides actionable blueprint for strengthening worker protection globally. This is our guide, which details strategic objectives and specific targets, as I've seen, which needed to build safer workplaces and healthier lives. And finally, it's important to translate the GFC targets into real world protection for workers. And this demands urgent collaborative action from all stakeholders. So the framework is a powerful tool, but its true impact will hinge on the collective commitment and cooperation of governments, employers, workers, civil society, academia, researchers, etc. And this is working together to achieve this tangible improvement. The goal is to transform lives from challenging circumstances to healthier futures. We've seen this picture here where everyone is healthy and happy in their workplaces. So let us carry these messages forward as we work towards a world where everyone works in a safe environment free from chemicals. Thank you.
All right, thank you, Dorothy, for that excellent presentation. For those of you who are just joining us, I'm Chaz Kaiser, communications consultant with the Global Framework on Chemicals. And of course, you're in the online discussion, Strengthening Worker Health and Safety in Chemicals and Waste Management. We just heard from Dorothy, and now we are really lucky to have representatives from the International Labor Organization on the line, including Manal Azi, who will give an introduction and overview, followed by Hauschka, technical specialist in occupational safety with health with IOL. And before we do, I just wanted to say that we have a lot of different people on the line from throughout the world. I see that people are already giving shouts outs to their country. We have Argentina, Uganda, Ghana, my country. I'm American, but it's still my country. India, and just a lot of different people represented. I see Ethiopia, Tanzania, and so, I mean, Global Framework on Chemicals is global, and we're glad to have so many people representing different countries on the line. Manal, if you will to go ahead and take over, and thank you for joining us.
Thank you so much, Shaz, and so happy to join you on this discussion and to have a dedicated discussion for the health of workers, safety and health of workers, and prevention of exposure to hazardous chemicals and substances. I'm also happy that we're able to be joined by our colleagues representing employers, representing workers, and representing some governments, and seeing the huge turnout also from the participants ahead of the discussions in Uruguay. So I'm Manal Azzi. I lead the team at the ILO on occupational safety and health policy. As Shaz mentioned, Halshka Gresek, my technical colleague, technical specialist, will discuss in more detail in her presentation right after. I really wanted to join to set the scene again, and for the first time, I think as the International Labour Organization, we're not the only one setting the scene from a global perspective. I'm so happy that, Dorothy, you've joined the GFC Secretariat. For a long time, we had been missing a specialized persons sitting in the Secretariat discussing both health and labor, where we don't need to re-explain the relevance and the necessity to focus on the protection of workers. You did that very well, especially by citing your own experience as a medical doctor in the field and what this means. And I think we face that challenge a lot throughout the past number of years, where we've engaged from the shift from what SciCam's objectives were to today, the adoption of the GFC framework and the Bonn Declaration. You mentioned, Dorothy, in your presentation, for example, 3 of the targets that clearly hold a role and objective for workers. We've identified at the ILO over 9 of the targets that speak to us, and that I think to fully implement and contribute to their implementation, the setup where the ILO is and its constituents will need to play a big role. If we want to see a change between, SciCam that was not able to meet all of its objectives over the past, 2 decades, today GFC needs to change something, and I see it is being changed a little bit in the governance structure, but we have yet to speak about sort of funding availability for the right people channeled to the right projects, and that's something that's growing this year as well, as you mentioned, the trust fund. So just a reminder for, people and faces have been changing from all the stakeholders. The International Labour Organization is that specialized agency in the UN system. With over 100 years, we were born in 2019, in 1919, before the creation of the UN. And our core constitution, and that was declared again in 1944 with the Philadelphia Declaration, states clearly that protecting labor is not a commodity, and all workers have the right to protection against sickness, disease, injury arising from their employment. And more importantly, 2 years ago, these rights were embedded in what we call the framework for the principal right at work. So safe and healthy working environment became a clear principal right at work. So countries have an obligation to meet this right. For us, chemicals, you mentioned, causes a lot of deaths globally. We have an underestimation of that number, 1 million deaths a year, but so many millions are exposed to debilitating diseases, chronic diseases that, have a cost to their families, to the communities, and of course to the economy. And so with the targets that we're looking at today, for us, they're not new at the ILO. We are set up in a way to respond to these targets. We have standards. Our normative system has a very strong supervisory mechanism. So we have binding standards. So they're not voluntary to actually implement some of these targets stated in the GFC. So I think what we need today is to find a mechanism where the ILO can be strengthened to respond to these requests. We did present these targets and the adoption of the GFC framework to our governing body made of employers, workers, and governments. And their main concern with this ambitious, objectives and targets is, who is being strengthened today to deliver. My understanding is, of course, that countries, you want country level implementation, you want some sort of independence, you want to remove extra costs that can come with the involvement of international agencies. But this is a bit somehow today causing inequalities between people who can access these funds at the country level for different reasons. People who have experience in developing projects as such, world of work representatives that can't access for different reasons, the ILO not being able to be resourced enough to provide that support while it is made for exactly that purpose. So today, if the ILO were to support a country to improve its chemical management systems, we would be, changing legislation. This is our mandate, supporting the change of legislation, which is a key target A1. We would be supporting countries to develop safety and health profiles that include chemicals, among other risks. And we're talking here about, highly hazardous pesticides in agriculture, to issues related to asbestos in construction, to multinational companies, but also to micro and medium small companies, to workers across all these sectors. So this is the people we speak to. These is the mandate of our national standards on chemical safety and protections. So we have all those standards. We have the technical guidance. We have the codes of practice. What is needed is support to implement some of these principles that have been negotiated over years and adopted with consent, with unanimous agreement sometimes, but also with agreement among workers and employers and governments. So the way we see this moving forward and looking at target A1 on legal frameworks, I have them in front of me. The chemicals toolbox, target A2, that has a clear management system approach that we deliver on target B4 on risk assessment and waste management. Even the GHS, that system that the ILO was one of the founding members and our constituents in this approach, but also, the clear D7 and E6 that you mentioned, Dorothy, but also E1 and E2 for partnerships, networks, governments. So today, if we want to report back on the implementation of the targets and make a plan, and I know there's separate groups working on indicators, we need to make sure we leverage existing standards that already have supervisory mechanisms, and we leverage the right people that understand the world of work. And like I said, the world of work is huge. And I think there's a bit of misunderstanding where we say the word labor as if it's just like the unions somewhere doing something for some workers. But the world of work is employee representatives that represent industry. It is workers that represent all unions, sectoral unions around the world. And it is governments that have the responsibility to set these laws that we want to change, improve, and strengthen. And then the whole system from the national to the workplace level to make changes in risk assessment and in the safety and health of workers. The discipline of occupational safety and health is overarching and interdisciplinary more than ever today. So I just wanted to make those points. Sorry, I may have gone overboard. Halshka will complement with more detail, but I was really keen to set the scene again as we embark on a new negotiation process upcoming in Uruguay, and to reposition the International Labour Organization and its constituents as key leaders in implementing this new action plan for the GFC.
Right. Thank you, Manal. You did not go overboard. Thank you for the information and for really helping to set the scene and for talking about the need for, concrete action. That's what we are here for. Halshka, you can go ahead and take over, and thank you for being here.
Thank you so much, Chaz, and thank you for bringing the ILO into this important discussion. And thank you, of course, to Manal for the really thorough introduction. I think it really sets the scene of where we are and why we need to have world of work stakeholders involved, and that mention of the broader picture. It's not just the labor sector. We're talking about the employers, the workers, the governments that we're really pleased to have with us today, and also in Uruguay, to work together to achieve that actionable change in the GFC. So this slide has already been mentioned twice. This is about the impact. This is showing us the scale of the problem globally when we talk about workers' exposures to chemicals. However, we know that this is just a tip of the iceberg, really, even though the numbers are quite shocking. We know that these figures, the 1 million worker deaths per year, one worker dying every 30 seconds, are severely underestimated. We know that, for example, from asbestos exposure alone, one chemical of the many types of chemicals, we have more than 233,000 deaths per year. So almost 1/4 of that 1 million figure comes only from one chemical. So that really gives you the scale of this problem. It shows you also the broad exposure scenarios for many different types of chemicals. And as Manal mentioned, it's just not about the number of deaths. We know that 80% of the fatalities come from long-term chronic diseases, cancers, neurodegenerative problems, many reproductive issues. And so we see that there's also a big impact, economic and personal and community, from the long-term diseases that come with these kind of chemical exposures. So here I want to highlight the fact that when we're talking about chemical exposures in the world of work, we're talking about an invisible hazard. And we're not talking about one invisible hazard, we're talking about a cocktail of invisible hazards. It's very rare that workers are exposed to only one chemical hazard alone, and only one hazard in general, because in the workplace you have many different types of hazards that we need to consider. We're talking about new changes in the world of work because of climate change and because of changes in migratory patterns. We have many different hazards in the world of work that we have to consider when we talk about chemicals and when we talk about the potential protective measures. So here, the changing world of work. Dorothy mentioned the workers that might be most at risk to some of these chemical exposures. And our evidence shows that we have a number of different groups that can be uniquely vulnerable at different points in time. We have migrant workers that might be changing their places of work, that are not able to read chemical safety data sheets, labels, might not be able to have the information they need to protect themselves. With these changes in migratory patterns, we see women that are left behind in rural communities, that women now are the ones that are responsible for things like pesticide spraying in many parts of the world and are exposed to highly hazardous pesticides, which directly and disproportionately impact their reproductive health. We also see the new changes because of changes with the triple planetary crisis, new types of chemicals because of plastic additives, because of climate change, and also new work processes and work materials. When we think about the need for increased critical minerals and the workers exposed in those mining processes at the bottom of the supply chains. Also things like new materials, solar panel waste, and all the millions of workers that are working in the breakdown on different types of electronics. With these changes, we also see every year thousands of new chemicals that are entering the marketplace. There is no way for proper risk assessment to keep up with these new chemicals, which leaves a gap for worker protection. We don't have all of the information we need to know what types of occupational exposure limits to set and what type of protective measures would be the most effective. Now here with this slide, I want to highlight that when we talk about chemical exposures, when we're working in the GFC, we're thinking about the chemicals industry. We're thinking about chemicals production, but we go way beyond that in the world of work. We're talking about many different types of chemical hazards, from metals to dust and fibers, to different types of highly hazardous pesticides, cleaning agents, disinfectants, etc. The list goes on. And this is what carries us over to the many different types of sectors that we need to be working in. We're not just working in the chemicals manufacturing sector. Mining, textiles, agriculture, construction, we are hitting those sectors of concern in the GFC and well beyond. And here's a reminder also about the exposures and where they take place. We often think about a worker that is directly handling a chemical, perhaps at the production stage, but we know that workers may be exposed and may need protections throughout the entire supply chain. So from the very first start, like extraction, for example, in our critical minerals, all the way to those workers that are waste picking at the end of the supply chain and may be exposed to different types of chemical additives in plastics, for example. So I think we've well described the problem now. How do we respond? And Manal talked about the importance of working with our constituents, working with our stakeholders in the spirit of social dialogue, but throughout many different levels. So responding to this global health crisis at the international level with the GFC, but seeing importantly how it can trickle down to the national level through our international labor standards, and also to the enterprise and workplace level through more practical applications. So the first start is this legal framework that the ILO has created throughout the last 100 years and more. And the ILO is the only agency that has legally binding labor standards. These are developed with our tripartite constituents. They create binding obligations under international law, and they set out the basic principles for rights at work. With these conventions, we also have recommendations that provide further information for implementation. And importantly, also for our constituents and for the people today here in the webinar, a number of codes of practice that provide practical guidance for different stakeholders on how to implement different safety measures at the workplace level. Our most recent one comes from the textiles sector, which is also a big focus of interest for the GFC. We also mentioned the importance of referring to fundamental principles and rights at work. In 2022, the ILO's governing body agreed to change the fundamental principle and right framework to include the right to a safe and healthy environment. So now 187 member states of the ILO are obliged to respond to this to ensure that all workers in all sectors have the rights to a safe and healthy working environment. And this brings with us the importance of worker rights at the workplace level. So moving to this new paradigm of a safe and healthy work environment being a fundamental principle and right at work has moved us to a human-centered and a rights-based approach, recognizing that workers have a number of different rights, whether that's the right to information on chemical hazards, the right to training and education on how to safely use those chemicals, the right to participate in different levels of occupational safety and health decision-making, and also the right to remove, being able to withdraw themselves from a dangerous situation without retaliation. So here, getting to a critical slide, I think, for this discussion that we've mentioned already before, the importance of recognizing the existing legally binding standards on chemical safety and how they directly relate to the different targets of the GFC. So there's been a number of different targets that have been referenced already, but what we've seen from our review of our instruments is that, in fact, a majority of the targets of the GFC can be met through the implementation of ILO's labor standards on chemicals. So this is really critical to keep in mind because this means we're not starting from scratch. We have a solid legal foundation, and we've helped many countries to develop that legal foundation, and they continue to improve it in order to try to meet those different targets also of the GFC. So here you see for the different components of our Chemicals Convention 170, just that one convention, the number of targets that we could meet through the implementation of the different provisions of that Chemicals Convention. Now, it doesn't end here. The ILO has Chemicals Convention 170 with its recommendation, but we have a number of additional conventions. So before, with the slide about the fundamental principles and rights at work, we have our two fundamental principles, Convention 155 and Convention 187, as well as a number of these risk-specific conventions. So Convention on Major Industrial Accidents, on asbestos, on benzene, and then our sectoral conventions as well, our Agricultural, Construction, and Mining Convention that gives specific provisions on the use of chemicals in these sectors. So here we have a complementary approach also to the legally binding standards. We're not only talking about our Chemicals Convention, but many other chemicals conventions. And so I would inspire also the participants joining here today to visit our NormLex website to see what is the ratification status for your country. How are you already contributing to the different GFC targets by implementing legally binding labor standards? So in addition to our labor standards, we also have a number of additional technical publications and tools that are useful in providing the technical guidance at the enterprise level of how to protect workers, which also meets a variety of targets. And we have a number of training modules that can be used to raise awareness, to build information, to build capacity at the national and enterprise level, which also directly responds to the GFC targets on information and awareness raising. Now, thinking about Uruguay, and how we can link some of the work that we're doing at the local and enterprise level to the discussions there. We have a number of projects all around the world that are focusing in different sectors. We're looking forward to be discussing and sharing some of the results of those projects in Uruguay, namely on textiles, electronics, and also on HHPs. And we hope that you'll join us there for those discussions. So where do we go from here? We certainly want to hear from the other constituents that are with us today. I've highlighted the importance of making visible the invisible and making sure that chemical exposure priorities and challenges around the world reflect the real challenges in the world of work, that there is a coherence between the priorities of the GFC and also of the priorities for the world of work. To ensure that that happens, we need to make sure that we have the world of work engagement in the GFC. As Manal mentioned, it's not only the labor sector, it is the broader world of work. It's our employers, it's our workers around the world, it's the governments, represented usually by ministries of labor, but also by other ministries that deal with OSH issues. We need to make sure that we're bringing those important constituents to the key meetings of the GFC and that their voice is heard. So on that note, we want to hear from you. We're planning 2 sessions on occupational safety and health in Uruguay. Session 1 on Tuesday to investigate legal and national level frameworks and how they can contribute to the GFC targets. And our second session, which will be held on Thursday, about mainstreaming these important concerns that we've been talking about today into the implementation programs and making sure that we bring the sectoral priorities to the forefront. Thank you so much. I'll leave it here and I'll pass it back to you, Chaz, for our next speakers.
Okay. Thank you so much, Halshka. Thank you for ending your presentation with where do we go from here? To help answer those questions, we have perspectives from government, employers, and workers. And I'm happy to bring up on the video Maxwell Mamusi, Assistant Director for Occupational Safety and Health Services in Nairobi, Kenya. Good morning, although I know it's later there.
Yeah, good morning. Just confirm that you're able to see my presentation.
We can see it. Thank you so much.
Yeah, thank you. So my name is Maxwell Memusi from the Directorate of Occupational Safety and Health Services here in Kenya. Basically, mine today is to present to you on what we're doing here on the ground. I will tackle it in various aspects, particularly in terms of the legal frameworks, what we actually doing currently, and then probably what are some of the challenges that we're facing as a country. So in terms of the regulatory framework, we want to state that Kenya really welcomes the International Labour Organization resolution on the inclusion of a safe and healthy work environment in the ILO's framework as a fundamental principle and rights at work. And in terms of the GFC compliance implementation, our constitution actually gives right to every individual to entitlement of reasonable working conditions. And among these reasonable working conditions includes, of course, the occupational safety and health conditions at workplaces. In terms of the GFC targets, particularly on target A1, we have the Occupational Safety and Health Act, which is now the law that guides on matters of occupational safety and health in workplaces, and as well as its subsidiary legislations, a lot of legislations that accompany the main law, and all these are to enhance compliance and enforcement through workplace inspections. We do almost daily inspections. We have inspectors on the ground who go and visit these workplaces, and they do inspections on our behalf. The other important thing is, of course, which is a key GFC target, is on the issues of GHS. We are currently trying to integrate GHS standards in matters of improving chemicals labeling in workplaces. And the advantage for us as a country is that by the time the GFC came into force, was actually signed off, we had already had a law, which is the Occupational Safety and Health Act, which states on how chemical labeling and classification should be done. I think the only issue that it was very general, mentioning that should follow the UN classification. So we're now trying to probably develop some sort of guidance to help employers, to help occupiers, workplaces be able to comply with the requirement on GHS. Another matter on issues of GFC that is still part of the target is on collaborations. The Directorate of Occupational Safety and Health Services, which is under the Ministry of Labor, we are part of a multi-sectoral committee on sound management of chemicals, which comprises of the Ministry of Environment. We have the National Environmental Management Authority. We have the Ministry of Health. We have the industry, who are represented by the Kenya Association of Employers. We also have the non-governmental organizations that are very key in terms of matters chemical safety. On matters of practical implementation of safety in workplaces, we carry out workplace audits and air quality monitoring for exposure of workers to chemicals. So basically we have approved persons, and it's because of the lack of capacity. What we've done is to get some specialists whom we've approved to work on our behalf, and they carry out these workplace audits and submit to us as the directorate for analysis and be able to see what are the conditions in workplaces that we might not reach at all. We also carry out air quality monitoring, particularly for exposure where there are hazardous substances based on the processes that are involved in various industries and workplaces. We also do training of workers and employers on chemical handling and emergency response. This is part of the syllabus in what we do in the Safety and Health Committee rules, where we require that workplaces form some health and safety committees, which of course has the representation of the management, the representation of the workers, and then it further even gives a guidance on how the workers should be able to select for them who should be in the committee, and then of course the management can be able to appoint who should represent them in the committee. We also have inclusive measures for physically challenged persons, of course, in terms of workplace safety, the requirements, in terms of access and the rest. Key among it, of course, is some of the activities that mainly focus on the informal sectors and what we call the SMEs here, small and medium enterprises. Particularly, we normally do this free of charge towards the celebrations for the World Day for Safety and Health, which includes now the free medical camps to check on the medical status of workers that are exposed to particular hazards. We even further do free hazard monitoring. We carry out measurements, be it the air quality, be it noise, in these workplaces. And we even train these workers free of charge, just try to help the informal sector. Now, in terms of the challenges and the opportunities that probably we can engage with the GFC and the ILO, of course, though we still have officers and inspectors, but we still have a lot of enforcement gaps because of the capacity in terms of monitoring. We have gaps in terms of the infrastructure, be it the equipment for monitoring of these hazardous substances, be it the equipment, be it, yes, we have technical capacity, but we still limited. We cannot be able to cover everything. And so these are some of the enforcement gaps that would be necessary to improve on as a country, and maybe see how through the GFC, through the ILO, how we can build synergies to build capacity in terms of infrastructure, in terms of legislation alignment. As I mentioned earlier, is that even before the GFC was already signed, we already have some legislation in place, which speaks of some of the elements in terms of the GFC and even the ILO conventions. And probably it's an opportunity for us to see how we can review these legislations so that we're able to achieve maximally on the GFC targets. The other thing is on the industry compliance. There's been a big question with the industry that they ask us, then what do we gain from this? And sometimes we might need some form of incentives. And particularly if you come to the informal sector here, it's rarely regulated. Again, it's unrecognized to some extent. And sometimes this is the form of living, be it in the artisanal gold mining, which now the government here is trying to register them in forms of cooperatives and such. So probably we might need to see what are the incentives that we can provide to the industry where possible. And the other issue is on leveraging of digital solutions for real-time monitoring of hazards tracking and enforcement. Currently, we have developed some sort of an online system which has really helped us improve in terms of the inspections of workplaces, audits, but still there's still a big gap in terms of what we need to acquire for the data that we might need in terms of reporting of these standards and the GFC. And finally, as my last slide, in terms of call to action, just to really emphasize that we must be committed to advancing workplace safety regulations. We must also be committed to collaborating globally for stronger worker protections. And just to say to you that ensuring workplace safety is not just a policy, it is a necessity for well-being. So otherwise, thank you. And I think I'll stop sharing from there. Yeah.
All right, thank you so much, Maxwell, for representing here today government policymakers and for talking about the challenges and solutions you are working on in Nairobi. Thank you also for pointing out ways in which you are working to align with the global framework on chemicals. All right. Next, we will have Robert. Oh, thank you. Thank you, sir. Next, we will have Robert Marinkovich, advisor for the International Organization of Employers.
Thanks a lot, Chaz, and thank you for everyone. Thank you to all of you for being here. Thank you for having me and inviting me. It's been a very interesting discussion so far. So I'll just start with a short summary of IOE, the International Organization of Employers. For those who might not be familiar, we heard a lot about the ILO and the ILO's activities. So the ILO is the only UN agency that has a tripartite structure, and so it involves and coordinates its activities through the engagement of governments, but also workers and employers. And so the IOE is the official representative of employers organizations in the ILO. We're a global network based on our member organizations, and the members are national employers organizations whose members are then companies. So we represent the private sector globally across all sectors. So we've been involved in all of the work that was mentioned previously on ILO standards, conventions, and recommendations. Currently, there's an ongoing discussion at the ILO, which will resume in June at the International Labour Conference, for example, for a new convention on biological hazards. So it also has an important element of OSH in there, and I think a lot of the elements we've approached here come up as well in the context of biological hazards. So yeah, I would just like to give a couple of elements, I think, from the perspective of employers. I think a lot of good things have been said already, and obviously it's a complex topic and a very important one. I think, first of all, as was mentioned, international collaboration and instruments like the GFC are key to set the framework to enable information sharing and capacity building specifically, to enable the solutions that are out there to be scaled up and to be used in various contexts. So I think, first of all, at the global level, instruments like the GFC and all of the work that the ILO is doing are crucial to further implement at the national level. And I think, as was previously said, a lot of solutions and knowledge are out there. So in my view and in my perspective, I think implementation is the main challenge really, and means of implementation are a key element there. So things like capacity building, and then access to things like finance, access to technology, access to information. I think that's what is really needed more. When it comes to private sector, obviously, I think it's important to keep in mind the diversity of the private sector, from huge multinational companies to much smaller local and regional employers and SMEs and micro enterprises. And in that context, of course, I think it's important to mention the informal sector. So of course, when it comes to all things related to OSH, the informal sector can present a particular challenge. And at the global level, I think that's where we should be seeing a lot of progress, or at least an opportunity for a lot of progress, because often it's outside of existing regulations, and often there are specific challenges that need to be addressed there. From the view of employers, I think what is important is to strike sometimes a difficult to find balance. Obviously, when it comes to chemicals and when it comes to many other things in the world of work, chemicals can be very useful in a lot of ways, and they're essential for a lot of our industries and economic activities and businesses. But on the other hand, they obviously present all sorts of hazards and risks. And what is key is to find the balance between using all of these products and substances, but to do so in a safe way. And for us, this is always based on a risk-based approach. So I think as employers, the key thing for us is to really work through the lens of risks and to ensure that appropriate risk assessments are done, and that business activities are based on this risk lens, because we believe that risks and hazards can be minimized, and accidents and harm to human health can be prevented through the appropriate use of OSH practices. And again, I think we can see a lot of best practices and good ways of doing this with many employers. On the other hand, there are of course those that can do better. And in order to do better, we always advocate for a collaborative approach that's based on close coordination between governments and workers and employers. Social dialogue obviously plays a role, but also coordination between different ministries and coordination with employers on the ground. And I think from the presentation of our colleague from the government in Kenya, we heard a lot about that, and inspection plays a key role. And again, capacity building there is crucial. I think much more could be done there in order to ensure that the appropriate resources and capacities are in place to ensure adequate inspection and monitoring and evaluation. Often, I think employers can have resource and capacity issues, can have a lack of adequate information. So I think first of all, obviously awareness raising and knowledge sharing are important, but it is important that there are support systems in place and inspection systems in place to ensure that the regulations are implemented well. Perhaps, yeah, just a couple of final remarks, I would say, and I'm also curious to hear questions and to participate in the discussion later on. It's important to mention that there is an upcoming discussion at the ILO in 2027 on consolidating ILO's instruments and standards on chemicals. So this will be a 2-year discussion as well. We will of course be involved in there as representatives of employers. So I think it will be interesting to see the interplay between the GFC and the discussion at the ILO on chemicals and on streamlining ILO's instruments in that regard. And then finally, just to say that I myself have not been involved in the development of the GFC so far, but my understanding is that there was a good involvement of the private sector, which I'm happy to hear and read about. There are obviously specialized associations and organizations focused on the chemicals industry, and a lot of them support and actively promote the GFC. And so it will be definitely interesting for me as well to see how the discussion develops in Uruguay, and how we can jointly promote further progress when it comes to OSH in general, but specifically for chemicals. Thank you.
Okay. Thank you so much, Robert, for providing us with reflections from the International Organization of Employers. I did leave the link to your organization in the chat for those who were not familiar. Before I go ahead and jump to Aripon Chowdhury, I did want to say that we have, let's see, at least 130 people on the call right now representing a wide range of countries. And we even have someone who said that they just got in from handling an HHP accident. And so, of course, it just goes to show how timely and relevant this conversation is, especially ahead of the Global Framework on Chemicals International Conference in Uruguay, where the protection of human health and protection of safety and health for workers will be interwoven throughout the conference. Ripon Chowdhury, if you could go ahead and come online, and of course we want the perspective from workers.
Thank you, Shaz, for inviting us to join this conversation, and I think it's very useful and very timely. From the trade unions, we believe that a safe and healthy working environment, especially regarding chemical risk, cannot be achieved without meaningful workers' involvement, robust regulations, and a commitment to prevention and protections. Therefore, the empowering workers, especially the most vulnerable, with knowledge, with voice, and legal safeguards, are essential to achieve these goals. By this time, so we have seen a number of presentations, including from ILO and government, and from GFC Secretariat, and it's very interesting and useful. Trade unions actively contribute the fifth session of the International Conference on Chemical and Management in September 2003 in Bonn, Germany. Working alongside the government, we supported the adoption of the global framework on chemicals, the shortened was GFC, to ensure a planet free from harms caused by chemicals and waste. So our involvement included participation in the consultation, negotiations, and the final adaptation process was very much interactive and participatory. And it is also we'd like to highlight here that the framing to penalization process trade union constantly advocating and lobbying for inclusion of occupational safety and health in the ILO framework of fundamental principles and right at work, as well as the decisions to the UN General Assembly to recognize a clean, healthy, and sustainable environment as universal human rights at these instruments. So therefore, the priorities for the workers are very much, I can see that very clear. Our priorities are right to have a safe workplace, right to know and be informed. That is one of the key priorities trade union wants to see in the process of chemical and waste, addressing chemical and waste related exposures and risks and impacts. And workers must be fully informed about the chemicals that chemicals they are exposed to, including the risk and safe handling procedure and emergency measures, and clear labeling, access to safety data sheets, and also training are essential, especially for migrants and low literacy workers. And trade unions are strong advocating for a strong regulatory framework and enforcement. And by this time, we have heard from the ILO presentation about the importance of the ILO Convention 170 on chemicals and global harmonized systems, GHS, and also regulation must require employers to eliminate or substance hazardous chemicals where possible. So active workers' participation in the process is very crucial, and workers and trade union must be involved in the occupational health and safety decision makings. that are very crucial, and establishment of joint health and safety committee in workplace with a real authority is vital, we believe. And protection of vulnerable groups, as we already heard in the previous speakers also highlighted, especially the attention must be given to women, youth, and informal workers and migrants who are often exposed and less protected. And policies should prohibit pregnant and nursing women from working with certain toxic chemicals. And access to health service is very important, and compensation. We believe that workers exposed to hazardous substance must have access to regular health screening, medical treatment, or compensation for occupational diseases. Therefore, we have some priorities like training and capacity building, regular accessible OHS training tailored to specifically chemicals, hazards, and roles, use peer and peer education, union-led programs to build grassroots awareness, and also hazardous elimination substance, replace hazardous chemicals with a safer alternative as possible, and promote cleaner production and green chemistry in the industries are very important. And strengthening inspection systems that already highlighted in the previous presentation, and also the ILO presentation as well. Enhance the labor inspection systems, allow enormous reporting of unsafe condition, and encourage whistleblower protections and grievance redress systems. So, and also we believe that the data collection and transparency, this area need to be strengthened and improve national statistics on occupational chemical exposure related to disease, encourage employers transparency in chemical use in and accidents, and also personal protective equipments where is very important to provide appropriate and equal quality PPE free of cost, alongside the proper training how to use it, and implementation of engineering controls and safe work procedures. So I want to, before I conclude, I just want to highlight that we, the trade unions, strongly emphasize that the successful implementation of this GFC can only be achieved at the national level through meaningful inclusion of workers and trade unions as key implementation partner, and that require due attention to the areas such as occupational health and safety, a just transition and decent work, and supply chain responsibility, including due diligence and accountability of international financial institutions and international investors such as pension funds, and alignment to international trade with strategic objectives of this new instrument, and also the public sector procurement policies that promote the sound management of chemical and waste. So additionally, the fundamental workers' rights, social dialogue, social protection are essential building blocks for achieving and this is the demands from the trade union. And I really appreciate for inviting us, and we'll be happy to answer if anyone have any questions, and we'll be uniquely engaged in the coming Uruguay round of discussions from the trade union sides together with our colleagues from the various countries in the globe. Thank you very much.
Okay, thank you, Repon, for ending the speaker discussion so well with the discussion on workers. I have asked if anyone has any questions specifically for our speakers to type them directly into the chat. If not, we are going to go ahead and commence with the online discussion. Again, we had our speakers to frame the topics, our expert speakers, but we have a wide variety of people representing health and labor and other specialties on the call, and this is meant to be an online community discussion. And so I pasted the questions, the primary ones we want to focus on in the chat. I'll go ahead and bring them online right now. And then if you could just raise your hand to answer those questions and give your perspective. Again, we have limited time. I think now we only have 25 minutes. So if people could limit their responses to 2 minutes, that would be good. And again, if you would just raise your hand to go ahead and give an intervention or to discuss, and we can call upon you. I'll go ahead and share my screen. Give me 1 second. And again, you can type your questions into the Q&A. Okay, Karen, if you're online, can you tell me if you can see the Q&A questions?
Yes, Chas. And then you
You
have
can see them?
questions from Gopal, Edith, and Shubendu in the Q&A chat box. Maybe we should address this first.
Okay, good. All right. It's hard for me to see with this online as well. Could you go ahead and read some of the questions? Help me, Karen. And if there's for specific
Yeah.
speakers, I'll let you.
Gopal, do you want to speak now? I can allow you to talk so you can ask your question directly to our speakers. And yeah, to the entire community also. Or no? I allowed Gopal to speak now, but
Maybe I can speak to Gopal's question.
I
Yes, I think the question is around communities underestimate this, these issues. I presume these issues, chemicals exposures in the workers, how community attitude can be changed. I think that's a very good question. Changing attitudes of communities, I think, takes time, but it's not impossible. So I think to change attitudes, there are three things, maybe or four, that can be done. Issues about increasing awareness. We've spoken about this, increasing awareness on what workers are working with and what are the health risks, not only to them, to their families and their livelihood. So that's important, not just to talk about chemicals in abstract terms, but more to a language that will speak to people, not just say, oh, chemicals are bad for you. People tend to shut down. When you just mentioned, I've noticed people's attitude is usually everything is causing problems. Everything is a chemical. So people tend to shut down. So it's important to tailor the message in a way that will connect to people's lives. Using community leaders, health workers, educators. So using people that can trust, workers can trust to provide that information. Also, to see the real change in the workplaces, having safe alternatives, not just to say we advocate all these problems, but if there is safe alternatives and they are used, people that might help to change skepticism to belief. But also, I know of programs that start people very young, building awareness and on health and safety in schools, vocational training centers. So you start people learning about health and safety at a younger age, so that when they come into the the job market, they have that awareness of risk and how they can prevent themselves. So I think that's a good combination of different factors that will help to change attitudes.
All right, thank you so much, Dorothy. We have a question from Mohammed. Karen, if you could unmute Mohammed, bring him on screen, he can ask this question.
Can you hear me? Hello.
Yes, we can hear you, Mohammed.
Okay, I'm. My name is Mohammed Sharabi. I'm an ecologist from Yemen, and now I representative of International Youth Council. From your discussions, I understand that if we start to establishment of structure framework, and make our mandate and other targets areas, who's responsible to send it to him? Hello?
Thank you. Mohammed, will you repeat the last part that you said?
I said if we have to establish structure framework for chemical pollutions in Yemen. After
Okay.
that, we have to send to who's responsible for this?
Dorothy, were you able to hear the question? You're asking about you're asking where did some responses, Muhammad? I'm sorry, I couldn't hear the last part again. So sorry.
Okay.
Okay.
I will again, if we establish structure framework for chemical pollution in Yemen, after that we have to send it who's response to send him?
Ah, you mean for the global, who's responsible for
Yeah,
sending the global framework
yeah,
on chemicals?
yeah.
Okay. Okay. Dorothy, are you able to help answer that on how do people send what they're doing on the ground to the global framework on chemicals?
Mhm.
Yes, I think
Okay.
I as I'll say I would say because this is a collaborative effect because as the ILO has mentioned, they are the UN agency with the mandate on workers' health and safety. So that's like I would say it will be a collaborative endeavor between the ILO and the GFC Secretariat. So it can be sent to the GFC Secretariat and then mobilize with the ILO on how to support technically to support that type of work within countries. But yeah, as I said, it's collaborative effort between GFC Secretariat and the ILO, with the ILO taking the leading role as the UN agency with the mandate.
Okay. Hauschka, could you add on to that for the ILO?
Yeah, thank you so much, Shaz, and thank you so much for the question, Mohammed. I think it's an important one. And it brings me also to some of the questions on the screen here about the challenges and the enabling frameworks. And we see here a huge participation in this webinar. We see all of the comments, all of the questions. We see where people are coming from, that there are people responsible for things like HHP exposures, right? That there's people from different ministries, that there is a significant interest in the world of work and in occupational safety and health efforts. I think there's a bit of a disconnect, and it's something that we need to all be working together with on how we can make sure that what Mohammed said, the things that are being done on the ground can be effectively reflected with the GFC, and how can we make sure that the right people, the right constituents are also present in the GFC discussions and in the events. We know that a majority of the national focal points for the GFC come from the Ministry of Environment, of course, very much responsible for a lot of chemical safety management issues. But I think our discussion today also shows the important role of other ministries, ministries of health, ministries of labor, and their contributions to safe chemicals management, either through their national frameworks or through their different workplace level actions that are taking place in the country. And so here's where we see, the need, if we're talking about the challenges in establishing a framework that's really meeting the needs of the constituents. How can we make sure that we operationalize this multi-sectoral spirit that we're talking about for GFC? And how can we make sure that the people that are in this chat, the people that couldn't join today, but that are engaged in safe chemicals management from the world of work perspective, can contribute to our discussions, can make sure that what they're doing is reflected in the targets, right? And reflected in the work towards the target. So I think that's critical going forward, that we continue these discussions and make sure that we bring the world of work into this. Thanks.
Thank you.
Thank
Thank you.
Thank you so much, Halshka. Again, we have the Q&A and discussion questions on the screen. You can feel free to type your answers directly into the chat or to raise your hand and we can call on you. I see from Hyacinth, she said one of the challenges is communicating with farmers in remote areas to get their input when planning interventions. She also noted that also to build farmers' capacities efficiently, perhaps radio programs for farmers. But she wants to know how sustainable is that. When I worked in Ghana with the when I worked in Ghana on a project, we actually did have radio programs for farmers, and that was like a really good way to reach them. All right, again, you can feel free to type your answers in to the chat box or to raise your hand, and Karen and I will try to see them. There's some general input on things that people are doing in their country. Someone says, thank you for this. We're going to work hard so that we can reduce chemical products in our country in Rwanda. We try to fight against it. Thank you for that. Okay, so our questions that we're asking, 3, what is the biggest challenge you see in ensuring decent working conditions for workers exposed to hazardous chemicals and waste? If there are any specific approaches that you guys online are using in your country, you can feel free to share it in the chat box or to raise your hand to share it. And then we want to know if the GFC emphasizes enabling frameworks and capacity building. What is the most urgent need in your context, whether it's legislation, technical training, infrastructure? You can feel free to share that as well. Daniel's put, one of the concerns that chemical handlers are often informal with limited education, and that has been mentioned, 0 medical covers and broad job description. He has also mentioned that in his country, that they're called caretakers. All right, so we also have to be very cognizant of the wording we're to use. Not everyone is called a health worker. I would never think that someone would be called a caretaker. So that's also important to note. Karen, do you see any hands raised?
Yeah, Azza would like to share, I think.
Okay.
Hi, Azza, you can speak
Thank you.
now.
Okay. Okay, I'm from Ethiopia. One of the major challenge in the chemical management in Ethiopia regarding the safe working environment for the workers is that the awareness that the workers and also even the owners of the industries have is not that much enough. That is, they do not understand the extent to which the chemicals are going to result in a long-term irreversible impact in their health and also in their future lives and even to their families. Actually, there is awareness creation programs that are created, and also our EPA, Environmental Protection Authority, the regulatory system. We usually follow up the industries in order to monitor the factories in order to create safe working environment for the workers. Through that monitoring activity, we observe sometimes the factory owners, they try to some extent to create awareness for their workers, but usually it's not enough. So that the awareness that the workers have in order to use the protective equipment is not that much enough. That means even if sometimes they are provided with the PPEs, they don't use them because they don't understand to what extent the chemicals are going to affect their health. What Ethiopia is doing in order to just respond to the approach that we are using is we have one Minister of Labor and Steel. It works specifically on creating a safe working environment for workers, and there is also a regulatory framework, an occupational health and safety directive, which is going to be updated currently. So it's usually, I mean, it has a content that the factory or industry owners are having the responsibility to create safe working environment for their workers. But even in this aspect, in the enforcement of this legal framework has got some gaps. And in addition to that, the other major problem is that we don't have that much adequate enforcement of the GHS. This labeling in the value chain of the chemicals is not that much being implemented currently in Ethiopia. And for the future, we are planning to enforce this one more seriously. Thank you.
All right, thank you so much
Okay.
for that.
Okay. Okay.
Karen, do you see any other hands raised or questions in the chat box? Oh, okay, question coming in. How is the implementation of the guidelines on working with chemicals in low-income countries? Is there any data on the usability of the ILO guidelines in these countries? I'll go ahead and I'll paste that again into the main user chat. Perhaps Hashka, you could answer that.
Sure, thanks, Chaz. I think what's important to keep in mind with any kind of standards or guidelines or codes of practice that the ILO develops, we develop our legally binding conventions with our 187 member states. So these are countries in different phases of development, of course, right? And so, of course, there's a risk in the applicability in different places, but this is exactly where the strength of social dialogue shines through, because we make sure that any kind of text that's developed is validated in a tripartite way and therefore applies to the realities of the countries where it will be adapted. And so the ILO has a number of ways also to make sure that conventions can meet the requirements in the national legislation as well. So a lot of the work that we do is looking at national gap analyses, reviewing the national legislation to see how it lines up with our different provisions and to see how they can be then adapted to make sure that workers are protected at different levels. So we have a project right now, for example, in Pakistan that's looking at chemicals that are used in the textile sector. And this project specifically aimed at making sure that the provisions in Convention 170, or Chemicals Convention, how they line up with the current national legislation. In addition, we looked at how we could implement different workplace level actions. Some of the things that were raised also by the previous person that asked the question about the awareness of workers, the use of PPE, things like implementing the GHS, how to make effective trainings at the workplace, so at these textile mills. So you see that there's a multi-level response that allows for different types of safety and health provisions to be implemented at the national level, but also to trickle down at the enterprise level. And so in regards to how we can make sure that the guidelines are applicable, the standards are applicable, we have a proven method of intervening in countries when we do development cooperation that uses this multi-level response and does everything in the spirit of social dialogue, making sure that workers, employers, and government ministries are on board to make sure that those provisions can be immediately implemented. So that's the strength really of the ILO's development cooperation projects. And we hope that we can work with some of you on those projects in the future. Thanks.
Great. Thank you so much, Halshka. We did have a hand raised. Karen, do you see it? I believe it is from Ms. Jennings.
Hi, yes. Good morning. Can you hear me?
Yes, we can. Good morning.
Okay,
Where are
thank
you
you.
calling from? Where
From
are
the
you?
Bahamas. Yes, from the Bahamas.
From the
I'm
Bahamas.
actually
Okay, it is
currently,
morning.
yeah,
Yeah.
at we're having, and so in the Bahamas, we're very, very slow in our occupational health and safety uh, protection for our workers. I'm currently at a national symposium. We haven't yet ratified the ILO 155 and 187 conventions. We're just discussing that and how we can do that. Our Worker and Safety Act, which in the regulations is all of 15 pages. And so we're very young in how to protect workers. And as a safety consultant and environmental, I've worked on projects, and what we're seeing is sometimes we're having trainings, related to Jeff Island projects and islands and chemical waste, et cetera. And a lot of persons have not been exposed to these kind of trainings. And so it's a question / concern, like what do we do as countries, small island developing states who are very, new or young or in the early stages of just actually getting up to standard with worker safety and protection across the board, because we don't want to wait until we get legislation passed, because that takes forever. And we've been, asking for proper occupational health and safety regulations and pushing for these ratifications, and they're just taking so long. And in the meantime, workers are dying. And on the private side, you can do stuff, but how do we get more involvement from the government, from I don't know if there are examples of what's being done in other countries on what we can do to really push this forward. We're doing a lot with the different conventions like POPs and Stockholm's and Minamata, but we need more of a concerted effort in trying to really get something done without having to wait on government to do something. So what can we do?
Thank you so much, Ms. Jennings. Halshka or Dorothy, could you help to share your opinion on that? And that would actually be the last question, then we'll wrap up and continue the discussion online.
I can start. Yeah, sure. Thank you, Ms. Jennings, for that question. I think you've really nailed it in regards to why the labor sector and why ministries of labor need to be involved in the GFC and in the GFC processes and in things like the open-ended working group. How can we establish good practices? How can we help government in these really practical questions? I agree that national legislation can be a difficult thing to navigate, ratifications of ILO conventions as well. However, it's important to recognize that many countries have put their national legislation in line with conventions without necessarily having to ratify them. They provide the framework, the foundation for what to do, what are the most important provisions, and those can be also adapted. So just to say it's not a major barrier in that sense, but in the process, we're not only talking about national legislation. There are many practical things that can be done in different sectoral areas and at the enterprise level. We have a very developed training modules when it comes to safety and health and chemicals, on different sectors. What are practical ways to prevent and protect workers from hazardous exposures? So there's a multitude of ways, technical tools and resources that the ILO can share. And this is where we see, in a place like the Bahamas, this is where we need ministries of labor on board, where we can connect them to the different stakeholders, connect them to the ILO, and make sure that there's that multi-sectoral engagement here to make sure we're protecting everyone despite challenges in legislation development. Thank you.
Okay. Ms. Jennings, I hope that helped to answer your question. Halshka, thank you so much. Again, we are going to go ahead and wrap up. I wanted to point out that this conversation can absolutely be continued, including on the Green Forum. Karen has went ahead and left the link to the Green Forum. If you are not a member of the Green Forum, it's free. If you are involved in anything related to sustainability and you need to be on there, and you can join. We will be having key takeaways and a recording posted on the Green Forum. For those of you who have not booked your ticket for Uruguay, please do so. If you cannot, we are going to have virtual sessions, including for Multi-Stakeholder Day, which is a Thursday full of at least 12 different sessions geared towards different sectors. And we will have one or two, I think it's more than two, focus on health and labor and healthcare. Again, thank you so much for joining us. My name is Chas Kaiser, moderator for today with the Global Framework on Chemicals. And hope you enjoyed the discussion, and let's keep it going offline.
Thank you so much, Chaz. Thank you to all the panelists and participants as well. It was really a pleasure.
Thank you to everyone. It's a great
Thanks,
pleasure to join
everyone.
with you.
Bye-bye.
Bye.